Hello, I'm Trevor Petrie. I'm a certified hand therapist and I've been working in hand therapy for 7 years. So if you have been diagnosed with CMC or osteoarthritis, at that point the discussion is how should we treat it? And there are several different ways you can do that, and you can work with your hand therapist, your hand surgeon on finding out what's best for you. For some people, you can treat it conservatively. You can use splints, you can use heat. There are different exercises depending on what you need that you can do to help relieve some of that pain and maybe offload that thumb. But if it's to a point where that pain is so bad that you just can't do most of your everyday activities and the conservative management isn't working, there are different surgeries that you can do. Most of those surgeries involve removing the little bone at the base of your thumb called your trapezium, and then you take that out. After that, different surgeons have different preferences as to what kind of surgery exactly that you do. The most common one that I have seen is called an LRTI surgery, otherwise known as a ligament reconstruction tendon interposition surgery. So what they do is they take out that little piece of that thumb there, that little bone, the trapezium, and then they take a tendon that runs right down here, right in the front of your wrist. They cut it down here, and they take that tendon up and they make a little sling for your thumb to sit in to increase the stability of your thumb. And then they take the rest of the tendon that they have left over and they make a little cushion at the base where that bone used to be. And then usually what they'll do is they'll let you rest, and they want you to get a little bit stiff, and so you create stability at that joint, at which point the recovery can be fairly long. It can take 3 to 6 months for a lot of people to get back to doing their everyday activities after that surgery.